Rosacea affects more than 2 million people. It can look like someone is constantly blushing or has a sunburn. For Rosacea Awareness Month, our health specialist, Leah Sarich, here now with some treatment options that can help the situation.
Yeah, this is really nice because a lot of these people don't even realize there are treatment options for them because there is no cure for rosacea. So that's the first point. But rosacea is a skin condition where the patient experiences redness of the central face. So you're looking at the nose, cheeks, forehead, and chin.
Yeah, I've seen it a lot on cheeks.
For sure, right? Yeah, on the cheeks. And then for some people with rosacea, they can also get certain bumps on their skin as well. So some of them are red and some of them are white. So they can actually be almost like a pustule. And half of those, this is really interesting, with rosacea will have some kind of eye involvement. It has to do with their eyes. So they may have red, dry, irritated eyes, frequent styes, and even light sensitivity. So there's a whole lot going on here. But it's very difficult for those who have it. As you can imagine, it's right there on your face.
Oh, sure.
So it's going to be the first thing that people see. In fact, research now shows 75% of those with rosacea report a decreased self-esteem. And then they also have a 5% greater rate of depression than those with normal skin. So there's a huge psychological impact for sure. So this is Carmen. You can see she's got her rosacea. It's flaring right there. And of course, we're putting a TV camera on her. So this is making her a little nervous. And you can see she's got the rosacea coming there for sure. She's had it for about 20 years. You know, and when she was a kid, she told me, people used to say, oh, you're so cute with your ruddy complexion. And however, as an adult, that really becomes a different story. And you can see she's red in the face there. And Carmen says, yes, you know, rosacea really can have a huge impact on your emotional well-being.
You're very self-conscious because, you know, that's the first thing people see. They see the redness, they see the spider veins, they see the blood vessels, and you get the questions, are you okay, are you nervous? And just, so then it makes it more self-conscious because then it's brought to your attention, so then you go redder and redder, and then everything stands out. And so you're just very self-conscious a lot of the time.
There's 5 things.
Absolutely, right? Of course. So Carmen says she'd even wear her hair in front of her face or wear bangs to cover up her forehead. But she does say, you know, eventually as you get older, you just get used to it. And eventually, you can actually talk to a doctor about finding the right treatment options for you. In fact, Carmen told me when she first went to her GP, her first GP said there's nothing you can do for it. And that is absolutely not the case. So what you want to do is get some treatment, and it usually starts with a topical cream. And that's where Carmen started. And there are more and more becoming available all the time.
We've been using products like topical metronidazole to decrease the bumps of rosacea and also maybe to help with the redness. But now in the last couple of years, we've gotten a new agent that actually is approved to decrease redness of rosacea. So beyond if the topicals aren't working or if we feel that they have too severe involvement for topicals alone, then we will use oral antibiotics as anti-inflammatories, not as likely as antimicrobials. And then if that doesn't work or people only have blood vessels, then we treat it with either light or laser treatment.
So you see lots of options there. Carmen has tried a vitamin C peel and a laser treatment or a light treatment to get rid of some of those red blood vessels that she used to have on her face. And she says, she told me, the results have been phenomenal.
Oh, great.
Yeah, which is great. She says it's also really important to be aware of your triggers. So things that trigger her rosacea, things like caffeine, alcohol, warm rooms, even sun exposure can all make her rosacea worse. For sure, right? So she says avoiding those things is really important. Also using a special skincare regimen really helps. And then, of course, she encourages everyone who thinks they may have rosacea to talk to a doctor to get a referral for some treatment.
Okay, do we know like a cause for it? Or?
This is the tricky part. We don't exactly know what causes it, but there are a few things they know certainly are at play. So 40% of those people with rosacea have a family history. So there's a genetic component to it. Most have some amount of sun damage, so that's at play. There's an environmental element as well, and also abnormal inflammation going on. So we do have some understanding of how it works, but the bottom line is there's no cure for the condition. However, there are many things that can be done to control it.
Well, that's good. At least there are treatment options.
Yeah, absolutely.
All right, all this, of course, will be on Leah's blog, breakfasttelevision.ca. That's where you can find that out. It's 8:46.